If you suffer an acute episode of back pain, during the first few days you should try to slow down, relax and give yourself plenty of rest. Anti-inflammatory medication, ice packs or heat packs may be of additional help. Making physical activities slow and controlled is important because fast, jerky style movements are more likely to send your muscles into spasm, cause further injury and prolong the pain. Resting is important because if you become over-fatigued, your muscles are more likely to spasm or stiffen, which will restrict mobility and prolong your recovery. However, so long as you don't tire yourself out, a small amount of movement will be beneficial to help improve circulation, prevent stiffness, and reduce inflammation. If you can walk and move around without too much pain, try slow, gentle walking or similar light activities that don't involve bending for 5 to 15 minutes every hour. If you really do have to take to your bed, try to avoid continuous bed rest for more than 2 days, as you will run the risk of the muscles of your spine becoming weakened, which could prolong the problem or cause secondary problems later on. When it comes to using heat or cold on a painful injured area, it can be difficult to know what's best. Some conditions will respond better to heat, whereas other conditions will respond better to ice. A therapist with a specialist interest in back pain is the best person to advise you. As a general rule, if your pain is mainly due to muscle spasms or muscular stiffness, then heat to the affected area can help relieve the tension. Whereas if you develop tenderness on the bony prominences of your spine, or if you know you have a bulging or prolapsed disc, this is likely to involve inflammation, which could be made worse by heat, in which case the area should respond more favourably to an ice pack or frozen peas applied for 5 to 10 minutes at intervals throughout the day. If you are unsure as to whether heat or ice is most appropriate, a good place safe is to use contrast bathing to flush blood through an injured area. Alternate between 2 to 3 minutes of a hot water bottle and 2 to 3 minutes of an ice pack or frozen peas covered in a thin towel for 10 to 15 minutes. If you hurt your back whilst bending or slouching, so long as you do not have something called a spondylolisthesis and do not have advanced wear and tear of the facet joints of your spine, you may find it helpful to put your spine into the opposite position so that it bends backwards into extension. This is best done by lying on the floor on your tummy and resting up on your elbows. On the other hand, if you hurt your back whilst arching backwards from something like painting the ceiling, then you may find it helpful to flex your spine by lying on your back and gently hugging your knees up towards your chest. An illustration of this exercise is shown on our website www.nationalbackpainhelpline.co.uk. When an injury causes sudden muscle tension or spasm, people are sometimes tempted to immediately do lots of stretching. But this can be counterproductive if done too early, whilst the area is still in a state of shock. It is often better to remain as comfortable as possible and wait at least a couple of days for the injured area to calm down before embarking on a stretching regime.